Morning, everybody. Welcome. If you are in London, I will start saying we apologize for the rain, but it happens sometimes. So thank you for being here. I hope that you had the opportunity yesterday of attending the award ceremony last night, and so you saw the outstanding presentations, programs, and service. And today, here in this morning, we are going to have the opportunity of listening for the gold winners of the IHF Awards for 2021. We have 6 presentations covering the different zones, the different programs, and we will start with the gold winner of the Ashiaka Excellent Award for Green Hospitals, and will be presented by Ed Rubinstein, that I think is, oh yeah, that's right, that is, as you know from yesterday, that is Director of Energy and Environment in University Health Network in Canada. So, Ed Rubinstein, please come to the floor, and you will present the project have the title of A Healthier World Through a Sustainable Environment. Thank you. Ed Rubinstein, go ahead.
And is the device somewhere? Well, good morning. My name is Ed Rubinstein, and I am the Director of Energy and Environment for the University Health Network, a hospital in Toronto, Canada. And first, I'd like to say congratulations to all the nominees and everyone who won awards yesterday. It's really fantastic to see the great work that's been going on. And I'm going to speak about what we've been doing at our hospitals as soon as I can advance beyond my first slide here. So, one moment, please. Thank you. So first, a little bit about the University Health Network. We are a large academic teaching research hospital located throughout Toronto. We're probably the largest hospital-based research program in all of Canada, around 16,500 staff, over 1,200 beds scattered throughout our hospitals. But the things I'm talking about are scalable. So though we're big and we can do things in a great scale, I've seen similar things done in smaller hospitals. We have small hospitals, we have large cancer centers, cardiac, transplant centers, and things like that. We've been working on sustainability. I've been working on sustainability for over 20 years, much to my surprise, because I'm only 25 years old somehow. But we've really embedded environmental sustainability with what we do in UHN. And the tagline, A Healthier World, is actually our hospital's vision. We've been recognized across Canada, and this is great. This is one of our few international awards. So it's great to see the recognition beyond our borders. We are working on a carbon roadmap. We all know that climate change is a health issue. And it's interesting to see, so the green bars there are what we've done to the left of that line. I don't have a pointer here. To the left of that line is everything we've done to date, roughly a 25% reduction in our greenhouse gas emissions, our Scope 1 and Scope 2 emissions. But what's very exciting is if you see the brown part at the bottom right there, and that shows that we actually have a plan, and that plan has us on track to meet our IPCC targets, the science-based targets. We have some very exciting projects going on. Largely, we've focused on district energy now and energy efficiency, but we have some very, very exciting projects, and I'll show you a little bit more about those in the upcoming slides. But the also thing to point out is that, in the bottom bullet point there, we're doing energy efficiency, we're reducing carbon, but we've also saved the hospital over $30 million in utility costs. So this work we're doing, it's good for the patients, good for a healthier world, it's also good for the hospital's financial sustainability. And when I talk about sustainability, I'm not just talking about environment, I'm talking about overall healthcare sustainability. So just a few things on energy highlights. So we have a nice video coming up. But on the very left, we're very fortunate. In Toronto, Canada, we have the opportunity to cool our buildings using lake water, something known as deep lake water cooling. So We now have 3 of our hospitals on that. And I should point out, low carbon, but it's also making the hospitals more resilient, making their cooling systems more reliable. Without cooling systems, much of the hospital can't function. Our medical equipment will shut down very quickly. On top of that, again, these projects on the left are saving us roughly $2 million a year in utility costs. So good for the environment, saving us money, making us more resilient. It's a win-win-win situation. Lots of energy efficiency, LEDs. I'm happy to see LEDs most places I've been around here. We use a lot of water in healthcare, and we've really reduced the amount of water we used. Lots of different ways we cool. We have old buildings, we have new buildings, so many, many opportunities. I think it's roughly 7 million square feet of facilities we have in our network. More and more we're moving towards smart buildings, so having the ability to provide heating, cooling, ventilation where it's needed and when it's needed, and that's never been more important than now in the era of COVID. But we're working on having our buildings adapt to what's going on at the time. And the last one, which is very exciting, is the very right. We are now in the process, we've just started construction on what's going to be the world's largest raw wastewater heat reclaim project. This is going to reduce the Scope 1 and Scope 2 emissions from one of our hospitals by an amazing 90%. This is a hospital that's currently burning natural gas, and the heat is going to be coming primarily from sewage, believe it or not. So it seems counterintuitive for a hospital to be using sewage, but we're going to do it, and we're very, very excited. So maybe in 2 years from now, I'll be back to present a little bit more on that project. Hospitals create a lot of garbage. We need materials, we need supplies, they need to be clean. So we do a lot of work to divert, to recycle as much as possible, but we also work within our hospital network and with lots of partners to find different ways of not creating waste in the first place. We know we need these things, but we know there's a lot of waste. Hospitals are by nature hectic places, busy places, so we try to implement the systems so we don't create the waste in the first place, and the clinicians can still provide the care that they need to provide and take care of our patients, and then what's left over, we're looking for more sustainable ways of dealing with that waste. 16,000 staff need to get to work. We have, over 1 million ambulatory visits by patients. We're lucky, located in a large metropolitan area. There's a large opportunity for people to take public transit. We have a good subway system. We have buses. We have regional transit. But we also realize, especially in COVID times when many people did not want to take the subway, there's a large call for cycling. And more, not myself, but maybe some of the doctors have Teslas, have nice electric vehicles, so we're providing for that. We need to plan for this because the time to build the infrastructure is now before there's high demand. So over the past few months, we've added many more, hundreds of more new cycling places to lock up your bike securely, shower facilities and things like that, as well as places to charge your electric vehicle. Okay, maybe I'm finished. Oh, here we go. Now, the key part is we really work on engagement. I have a team of 7 people, and it's very difficult for us to be everywhere at every time. So we engage staff, clinical staff, non-clinical staff, to take ownership in environmental issues and then work with us to implement initiatives. So they understand the care they give, they understand the types of waste, the opportunities there, we have the environmental expertise, and then we work together to implement things. And you can see everything from, we have different types of recycling there, we have LED lights in our operating suite, which are actually the surgeons prefer to the old types of lights we had. And we have over 730 self-identified champions who, again, we work very closely with so that they can come to us and say, we would like to do something about waste in our operating room, for example. We bring the expertise. We make sure that whatever they want to do is compatible with the systems we have in place in the hospital, and together we roll out many initiatives. We also look at, we don't have a lot of gardens, but there's 2 great projects here. They're small, so the one on the right is very nice. This is one of our Bickle Center, a complex continuing care place. And we implemented and installed our first wheelchair accessible garden. So this is great. It creates green space for staff and for visitors and for patients. But as you can see there's one of our patients who very kindly consented to having his picture shown here, are able to use it as part of their therapy. So again, good for the environment, good in an urban setting, but also helping with patient care. And my team, our goal really is to make the hospital more sustainable, but also to support our key business, which is patient care. And on the left, we're going through a very important process right now in Canada. It's called Truth and Reconciliation, dealing with our Indigenous history and with Indigenous people. So on the left, we've just opened up an Indigenous healing garden. This is a chance for some of the native Indigenous plants and knowledge to be planted on our facility, and that knowledge to be transferred, well beyond that scope. So this is very exciting. And now, a brief video which will much more eloquently explain some of the things we've been doing. If it starts.
At University Health Network, UHN, we know climate change is a major threat to health. That's why UHN, led by our Energy and Environment team, is creating a healthier world through a sustainable environment. Located in Toronto, Canada, UHN is made up of 4 major hospital sites and 1 school of applied health sciences. Hundreds of green projects have reduced utility costs and greenhouse gas emissions. Some projects are large in scale, like using water from Lake Ontario to provide cooling for hospitals. Some projects are small with big impact, like eliminating straws from all patient meals and using reusable dishware, customizing surgical packs in the operating room so they only include what's needed, and wrapping sterile equipment in cloth that gets repurposed. Installing electric vehicle charging stations, creating hundreds of bike parking spots, building a wheelchair-accessible community garden, and countless recycling programs. None of this would be possible without buy-in from UHN staff. When we all pitch in, a strong culture of sustainability is possible.
And with that, I will say thank you.
Thank you, Ed Rubenstein. I remember hearing this presentation that we all know there was an important city when the personage was Caucus. And Caucus, as the Prime Minister of the United Kingdom, has said, to be green is not easy. But now here, I think the message for the people in Glasgow will be exactly as we have shown pretty well. Never lose the hope in solutions. And is a demonstration that we can be green and save, and saving money. So the message is quite clear. If you have any question, you can put, I think Rubenstein will be able, if there is any question or anything that you want to be more precise. If not, I don't see. Well,
First of all, it's very amazing projects for keeping sustainability. I just noticed 2 issues in the presentation that you make recycling for the single-use devices, as well as recycling for the medication instead of landfilling. So my question is, this was initiated from the organization separately or with initiative from the country?
This was initiated by the organization in partnership
Who is coming
with
next?
a
Is
third
there
party.
this
So
one?
the concern
Next?
with single-use devices, that's
Yes,
obviously
she's
once they've
Fatma.
been used,
Fatma,
you have to
she's here.
sterilize them and things like that. We're working with a private company, and there's a few out there who will sterilize it and then take it's a legal issue, the liabilities for saying this is a clean and usable product. Okay? So it's initiated by the hospital. The government, the support comes and goes. I've been there 20 years. We've had many governments come and go. So largely what we do is we move forward on our own. When there's government support, maybe we take bigger steps. But when there's not as much government support, we take smaller steps.
So you're just discussing to the authority, and they are the one who are doing the landfilling or the recycling?
We are doing it.
You are the one
We are
doing the
doing it.
recycling.
That's right.
So this is very huge investment, and recycling for the medication bottles and as well as also single-use devices, especially because it's you created a manufacturer or
No.
factories or what?
We work with existing systems out there, businesses and things like that. We pay, but we work with existing infrastructure out there. There's we are fortunate for Toronto. There's this big, large urban area, lots of opportunity. So we go out and we procure the service, and they assist us with that. We work
Great,
together.
thank you, thank you.
Microphone. Yes. What is it? Streaming. We're streaming.
No more questions? Well, I want to read these slides. There is someone? No. Okay. So thank you, Rubens. Well, I forgot in the beginning to present myself. I'm Carlos Pereiraus. I'm from Portugal, Lisbon. I'm a doctor and a surgeon, and I'm at the present time president of the Portuguese Hospital Association. So we go on, and we go to the next presentation that is about the award, the Gold Award of the American College of Healthcare Executives. And the presenter is going to be Dr. Fatma, I think is around, yeah, Dr. Fatma, that is a director of the Dubai Health Authority, and will present the winner of the American College of Healthcare Executives called Rapid Resilience Screening Framework, SPARK. So the floor is yours.
Great. Thank you so much for the introduction. So good morning, everyone. Allow me to introduce myself again. My name is Dr. Fatma Al-Sharaf, and I'm the Director of Corporate Quality and Excellence at the Dubai Health Authority. Today, we'll be presenting to you the Rapid Resilience Screening Framework, or in short, we call it SPARK, which have received the Gold Award yesterday from the American College for Executives, Healthcare Executives, and that was for the leadership and management category. There's always nothing better to start with than a quote from our leader, His Highness Sheikh Mohammed bin Rashid, the Vice President and Prime Minister of the UAE and the ruler of Dubai. UAE did not stop during COVID-19 and won't stop after it. And our project today is just a very small part of our small efforts in translation of this great leadership vision. So before we start, let me tell you a little bit about the Dubai Health Authority. Our vision is towards a healthier and happier community. And in line with our strategic direction, our strategic plan for 2071, our project is aligned with two main objectives. The first one is leading the global fight against epidemics, and the second one is building a resilient end-to-end healthcare system. Our strategic direction is then further translated into a mature process architecture. With the process architecture, as you can see here, we start off with 23 main process areas, drilling down to detailed almost 1,500 process models. And we can say that 95% from our business processes are aligned with international standards, being healthcare quality standards like the JCI standards, for example, or other managerial quality management systems like various ISO quality systems. So what is the Rapid Resilience Screening Framework, and why did we come up with it? With the start of the pandemic, we realized that there was a need for immediate and rapid change within the organization. We started looking at other renowned practices worldwide, and we realized that organizational resilience frameworks were not fit for our organization because they take a long time for implementation, and we needed something quick and rapid to safeguard the health and well-being of our community, the Dubai community. So we developed our own methodology that consists mainly of 5 steps. Each one of the steps represents a letter from SPARK. So if we go through the steps, the first step is S. So we start by studying the process or the service. Second step starts the P, which is predict adverse scenarios. So what is the best case scenario and the worst case scenario for each of those services, and what could go wrong? Third is assess the responsiveness, and this is based on predefined criteria or guidelines based on the situation that we are in. R is revamp the process, and this is totally dependent on the first 3 steps. So what is it that we could do to improve our service or process? And finally, control resilience capabilities, and those are through a number of measures or KPIs that we have put to ensure that we are going in the right direction. We're very proud to say that the SPARK methodology have been 100% developed at the Dubai Health Authority by the Dubai Health Authority team. And today, the SPARK methodology is registered as an intellectual classification in Dubai. We built SPARK around three main resilient themes. The first one is the safety of our community and our staff. The second one is the continuity of our critical services, since in healthcare it's really important to go uninterrupted. And finally, flexibility. And here, flexibility was really important to meet the increasing demands on the healthcare sector during the COVID-19 pandemic. Accordingly, if you remember the 23 process areas that we've spoken about on the second slide, we prioritized 9 of those process areas. And we focus on areas like, for example, patient care or preventative health or supply chain to ensure that we are working towards the 3 main themes that are identified. We enabled our human resources because we believe that they are the main cornerstone behind our resilient operations. So we created a power team, let's say, made of our process champions, and they were selected based on their process knowledge within their areas, as well as their process improvement capabilities, among other criteria. It was also important to build a strong, resilient culture to make SPARK a success. And we are very proud to say that our resilient culture started from our leadership buy-in and support. And you could see on the pictures here, the first one with Sheikh Mohammed bin Rashid. And when we're talking about leadership, we're talking about that level of leadership who were always on ground with us, who's the ruler of Dubai. And the second picture over there shows our crown prince, Sheikh Hamdan bin Mohammed. With this, and with their support, we were able to immediately change. Resilience was no longer a choice within the organization. Instead, resilience was a core business requirement for us. We were able to formulate a multidisciplinary team. And by a multidisciplinary team, we're not talking about the healthcare system only, but we're talking about the entire Emirates. So the multidisciplinary team included members from other industries, which we will talk about shortly. So our stakeholders, like we were just saying, were identified. And we looked at different methods to engage with our stakeholders, starting from collaboration, consulting, keeping them satisfied, or just informing them. Looking at the first one, we have over here the command center, which is an example of the success of our collaboration with our stakeholders, where we brought together people from the Dubai Health Authority and other leading organizations like the Dubai Police, Dubai Municipality, the Road and Traffic Authority, and so on. Why did we have the command center over here for collaboration? We supported them with real-time information through resilient dashboards, and that was important to make immediate, factual, real-time decisions based on the real-time data. So, as we always say, if we cannot measure it, we cannot manage it. And accordingly, we have identified a number of measures to measure our efficiency, our effectiveness, and our resilience. And those are a few examples of the measures that we kept monitoring during the project. And today, we're very proud to say that Dubai has been ranked the world's most resilient city. And this was reported by the United Nations Office for Disaster Risk Reduction. We're also prouder to say, the screens are not moving. Yeah. So we're also prouder to say that Dubai has contributed to the UAE achieving and being recognized as a pioneering health system. Today, the UAE has received several world ranks, amongst which they have been ranked the first by the New York Times for the cumulative COVID-19 vaccination doses. And according to Forbes, we are the #1 Arab country when it comes to COVID-19 safety. And this is not the end of our journey, but perhaps it's the story behind our strength, our commitment, and our promise to the world towards a healthier and happier community. Thank you so much for listening, and we look forward to seeing you back at Dubai, which is the most resilient city in the world. Thank you.
Thank you, Dr. Fatma. And it's exactly true. You have started saying that Dubai doesn't stop with COVID and will not stop after that. And the reason is exactly as you have said. Next year in November, we'll have this Congress in Dubai. So congratulations to Dubai. And keep going. Keep going. If there is any question to this presentation, please, you can profit now. If not,
So that means one of two things. Either it went really well or the opposite.
yeah.
Thank you, guys.
Thank you. Thank you. Okay. Well, unfortunately, for the reasons of last moment, we don't have Carrie Owen to present the winner of the AUSTCO Excellence Award Quality. For me, it's a pity because it was one of the projects that I've been involved in classifying. So I will give the floor to Dr. Aigul that will present, that is from Kazakhstan.
Good morning, colleagues. My name is Aigul. I'm from Kazakhstan, and I'm CEO of Medicare International Hospital. And now I want to present the next presentation who won the Gold Awards for the CGT Holding Excellence Awards for Corporate Social Responsibility. And project is Share the Gift of Vision, Advancing the Right to Sign and Ensuring Quality of Life. This project is an amazing initiative to bring back that quality of life to poor Filipinos, give them the ability to see again. A presenter is Jill Alvarez, who is the head of Corporate Social Responsibility Office.
I have to wear my glasses, otherwise I can't see. What an irony. Okay, so share the gift of vision. Can I remove my mask? Is that allowed? Okay. So, avoidable blindness is still remains a socioeconomic problem in the country. About 4 million Filipinos have no access to ophthalmologists and also to those with subspecialty regarding their eye problems. And what makes it more challenging is that we are composed of 7,100 islands. And we speak about 120 native languages. So given the situation, this is the data that we have. So there's about 4 million Filipinos living with undiagnosed eye problems, and 90% of them are economically challenged. 1.11 million Filipinos have cataract, and in our case, we have limited number of ophthalmologists, 1,573, and most of them are practicing in big cities. The reason being that facilities are in the big cities, and if you are to set up eye care center, it costs a lot. In terms of subspecialties, we have fewer. And one example is pediatric ophthalmologist. At the moment, we have about 44 to 50 pediatric ophthalmologists. So you can just imagine, we are 109 million Filipinos with only this number of ophthalmologists. And this is the backdraft wherein we decided 20 years ago. Of course, I was not yet in Manila Doctors then. I was still with the UN program, that it was decided that this program should be implemented to help decrease avoidable blindness. So the goal is to, of course, avoid blindness, especially for children, start the monitoring early on, and then to provide free cataract surgery, because in our country it is not cheap. Unlike my first two colleagues who presented, we are a developing country, so resources is a bit difficult. And we are a private hospital. We do not really receive financial support from the government. So it means we have to form partnerships. That's the reason why we had to form a circle of partners in order to expand this program. And luckily, the hospital, part of the commitment of the hospital is to allow the use of its facilities for free. The doctors give their time for free. The nurses, including those with doctors with subspecialties, including internal medicine and pediatrics, and of course, other allied med professionals. It started in 2001 with the minimum target of 90 eyes within the National Capital Region where Manila Doctors operate. So the National Capital Region is composed of 16 cities, but we noticed that every time we go on a medical mission in the provinces, the last team that would finish is the team of ophthalmologists. And so we looked at the figures, and we do realize that there is a need to expand the program in other provinces, in other regions. So our recent data shows that we about 2,370 individuals have underwent free cataract surgery already. Eye screening, we were able to provide 6,000 to 6,000 individuals, 4,300 eye refractions, because it's also part of the problem in our country, wrong eye refraction. And then, of course, as you go through screening, you will realize that there is a need for reading or prescription glasses. So from a modest start in 2001, we are now we have 18 regions, and we are now able to reach half of that region. So it's a good thing also that our Vision Center underwent a major improvement in 2014 and another upgrade in year 2000. Even though there's a COVID, we were able to create some improvements there. Okay, so the process is we go to certain areas that are underserved. This is where the partners would come in. They will tell us where there is a massive number of Filipinos or of patients who have no access to ophthalmologists. There is one province that we went to. It's the Batanes Island. It is actually much nearer to Taiwan than Manila, the capital where we operate. And we realized in 2017, the governor told us that the last time that they saw an ophthalmologist in the province was 10 years ago. So if that's 2017 when we went there, if you go back, that was the last time that the people had an opportunity to see an ophthalmologist. So after screening on site, we arrange with our partners to fly them or by air or by sea to bring them to Manila because of the lack of facilities in the provinces where we go to, where we do the screening. We cannot possibly operate there. And so right now we have about 69 partners that we tap in order to implement the programs. Some are assigned to provide free transportation to Manila. Some are assigned to provide free accommodation for patient and companion. Some are assigned to provide meals while they are there, and some are assigned to provide post-operative medicine like eye drops, because you cannot access some of those basic medicine in the provinces, and so it has to be provided after even before they leave Manila. So we also evaluate the socioeconomic situation of the patient, because there are those, although I am a bit ashamed to admit it, but there are those who would pretend to be poor when they are not. So the screening has to be stringent. Uh, so there is that's one of our social workers doing the screening, the economic screening, economic profiling of the patient that is applying for the to be included in the free surgery. And then we also do evaluation. We do aftercare home visit to see how they are doing, how it has improved their lives, and not just in terms of health, but also economic. The reason why I said it's a psychosocioeconomic is because if you lose your eyesight, if you become blind, then you won't be able to work, and you won't be able to work. There is also an effect on your mental wellness. And another effect on the economic prospect of a family that has a person with blindness is that you have to assign a caregiver. So that's two-person already who is unable to work or be productive for the family. Again, this is how we implement. That's some of the patients that are about to undergo surgery from the province after surgery. And then, of course, from 2017 to 2019 alone, this is how blessed we are with the generosity of our volunteer personnel. About 3,122 hours, or a monetary value of 397 million, have been given for free by our healthcare professionals to implement this program. Of course, we measure our impact in terms of improvement in their lives, in terms of the satisfaction of the services that we give, because we even if the hospital is a private hospital, we still consider ourselves as part of ensuring that the right to health, we are compliant with the normative elements of the right to health. These are the results of our evaluation. 99% have gained improved vision, regained confidence in performing their daily task. They can now independently work. They don't need to have a caregiver or somebody from the family who will stay with them. Those with congenital cataract can move forward with their education, because we do get congenital cataract cases from the provinces born already with a cataract. We just sometimes we just hope that we catch them early, because sometimes we get them at 5 years old, 7 years old, and it becomes more difficult for the doctors. They are less dependent on children for those who are more advanced in age. And they are, of course, happier because of the quality of life. They can socialize, they can engage. And there is one study that we saw that if you ask people which of the senses, if they are to choose, if they are to lose their senses, which one would they want to retain or remain? And they would always say, my eyesight. So as for psychosocial, improvement in interacting, in communicating, easier to engage during gatherings, and they have more positive disposition. They also have improved financial situation because they can work, they can be productive. And of course, like I said, there is no more need for family members to take care of them. It also improves in terms of those with pre-existing condition, because it affects it greatly affects how they are able to take their maintenance, medicine, their maintenance medicine. They can independently go to their doctors. They don't have to have a family member with them. It also prevents some injuries like fall. Injuries like that, especially for senior citizens. So we are hoping to continue with this program, and this is some of the results. The one on top is actually a mother and daughter. They both have cataracts. So we were able to provide surgery for them in the middle of the pandemic. And patient Eugene, he's this adorable boy, and he came to, we were able to encounter him in 2016. He was about, I think, 3 or 4 years old. And right now he is doing very well in school. And there is a realization also that when going to far-flung areas, that there is a need to access ophthalmologists with subspecialties, because the two patients below, they are not cataract patients. One has an orbital mass surgery that she's been trying to find solution for the past 3 years when we met her, and so she had to be brought to Manila to have the surgery. The other one needed a cornea transplant, and so really the realization, the need to bring the services in those areas, and to also advocate to those who are in authority to make sure that eye care is available in their localities, in their cities, because one of the most neglected area, I think, as we go through this the number of medical mission, is eye care. And so along with medical missions, with screening, we also do advocacy to the local government units, because our healthcare is devolved. So if a mayor or if a governor doesn't consider healthcare a priority, then chances are you would have no access to an ophthalmologist. So the province that I was talking about earlier, Batanes, we were fortunate that the governor listened, and now they have a practicing ophthalmologist in that area, which is very good for that, for the residents of that far-flung island province. Thank you so much.
Thank you very much. This is a great example of goodwill and cooperation between medical organization and the volunteers. So, and the next winner is French Medical Institute for Mother and Children, who won the Gold Awards in Sultanate of Oman Excellent Award for Health Service during the crisis. This project is dedicated to telemedicine, the new communication tech for people of Afghanistan that have no access to the medical services. And the represented is Aziz Ahmad Jan, CEO of French Medical Institute for Mother and Children.
Good morning, ladies and gentlemen. It is my privilege to be here today and present something different than what you all listen and watch the TV in the recent past and even every day in your life about Afghanistan. We are going through a tough time. I have spent 7 years previously in Afghanistan to develop this facility, and then I moved back to my parent institution. But then I was requested to go back for a few months. In end of 2019, I went there and then stuck with the COVID. So here is the French, as you know, that the Afghanistan is, maybe everybody knows these days because it is all over on the media, that it is a landlocked country. It has smaller but 34 provinces. It is very important because when you divide the provinces too many, so then you divide the resources. Population is around 39 million, some people say around 38, 39, whatever it is. The important thing is that the Kabul is the capital, and around 30% of the entire population lives in Kabul. I'm showing some of the data. You might have seen all this, but it is very important that still our under 5 mortality rate per 1,000 is 60. Our infant mortality rate is around 47. Neonatal mortality rate is 36. And this is the data which has been collected from some of, we may not have collected this sample data for across Afghanistan because of the security situation. Stillbirth attendant is 59% still, and maternal mortality rate is 638 of 100,000. The important thing, this data which I'm showing you with the doctors is of before the 15th of August, because since then a lot of people have moved to different parts of the world. And rough estimate is that around 25,000 healthcare providers have left the country, with 160 or 70,000 people who have flown out of the Afghanistan. And from my own hospital, around 70 people have left. And out of 70, out of 1,000 staff, 48 were the critical people. And out of around 1,000, around 600 people have already seek the experience later to leave the country. So you can imagine how difficult the situation is. But the important thing is that this was just a little background of the Afghanistan. When it comes to French Medical Institute, basically this project was envisioned by a French journalist when she came to Afghanistan to cover their military operations. She found a mother died during her coverage. She thought she will do something, and she came to France and she said, "Look, I want to do something for Afghanistan." And she got a good response from the population. So she collected, but she was not able to run the hospital. She requested Ministry of Foreign Affairs to give some partners. So the French Foreign Ministry linked with the La Chaîne de l'Espoir, which is a NGO in Paris, to work with them. La Chaîne de l'Espoir came to Afghanistan and started doing something with the pediatric services. But then, they were asked, we need a proper partner to run the hospital. Then it was approached to Aga Khan University. The Aga Khan University is now running and managing this hospital. However, we have 4 partners. We have Government of Afghanistan, Government of France, La Chaîne de l'Espoir, as I said, and the Aga Khan University, Aga Khan Development Network. We currently, we are around 169 beds, and we have a quite big number of intensive beds because that is the requirement in Afghanistan. We offer postgraduate medical education in 9 disciplines. Although our name is still Mothers and Children Hospital, but we are a general hospital now. We do all kind of services, the cardiology, the catheterization, except burn cases and oncology, we cover almost everything in the hospital right now. And this is the postgraduate medical education program. 5 out of 9 disciplines we introduced first time ever in Afghanistan, because this was not available in that part of the world. We provided care to almost 1.5 million patients so far. We started with 35 beds, and then gradually we have reached to 169. The important thing is that the patient, majority of the patient, although it's a fee-for-service institution, but the majority of the patients, they are unable to pay. So we have a big program of the patient welfare program, so ensure access to all those patients who are coming to our hospital. So we do not, around 600,000 patients since 2006, we have provided, and these are not the simple cases. These are the complicated and referral cases from across Afghanistan. And direct, apart from the hospital deficits, is around $41.6 million we have provided. I think this hospital, what has provided is, the most important thing is the postgraduate medical education program, as well as our normal programs which we are providing. And this is the main hospital where you feel you have the technology, you have the services, you have the doctors. We have spent around $20 million to send a lot of our doctors to Western world and North America. Unfortunately, 80% of them or 85% of them never return back to Afghanistan. So now we have decided we will train within the country or nearer to India and Pakistan or those areas. So we will not send to Europe and North America for the trainings. Women empowerment, this is very, very important for us. Everybody is talking about, but I think 27% of our workforce is women, and 25% management positions are with the women. Although it is a very difficult time right now for me, I evacuated with the rest of the international staff on 18th of August. But then my team went told me, if Kabul was so safe, why you have left? So I went back to Kabul and lived for 40 days before coming to the conference. So I'm coming to the FMIC. The plan is we have to add another 400 beds in this hospital. It's going to be a leading referral center, not only for Afghanistan, for entire Central Asia. And we are already connected with Tajikistan and providing training to the doctors and nurses. But since last 2 years, because of the COVID and now the situation, they are unable to come to Pakistan. And the important thing is, it's not about the building, it's about the human resource, the trained human resource we don't have. So therefore, we are concentrating to train. So our next project immediate is adding another 50 beds with 16, with 5 additional operating rooms, and so it's going to be in the 130,000 square feet building, another one, but unfortunately we have to hold it because of the situation right now. The project I will not discuss too much. As we all know, reaching to unreached. As we know, as I said, the Afghanistan has so many challenges. We have human resources challenges, we have trained human resources, people are unable to come, they have they don't have money. So in 2006, we said, how can we ensure access to the people? And especially we are running the entire 2 regions, 2 provinces of entire province health system is being managed by the Aga Khan Development Network. So we established e-health, started. Initially, we installed the CT scan and MRI, and there was no radiologists who were linked with Karachi, with Aga Khan University. Then we linked Aga Khan University, the FMIC with Bamiyan Hospital, and then Faizabad Hospital, and Khorog General Hospital in Tajikistan, Mirwais Hospital in Kandahar, and so on. So these, and then the Faizabad and Bamiyan hospitals were linked with our district hospitals, and district hospitals are linked with the primary healthcare workers, so to collect data and so on. So if you can see now, we are, the core objective is to provide healthcare services to the people who live in the rural areas, because they deserve this kind of stuff. Improve access to limited, physician resources. Definitely improve the, specialist effectiveness, and then reduce the cost of care. Definitely, because if people have to travel from regions to the Kabul for services, and 70% of the healthcare workers are in Kabul, unfortunately. And the majority of the people who used to live in Kabul, they have left, the medical professionals. And then share the knowledge, and one of the important areas is how can we use the technology to train the nurses, doctors, technicians, technologists, and so on. And of course, the quality assurance from the Western world and our affiliated hospitals from Africa, from Pakistan, India, so we are collecting. So I'll not go into these detail, as I said, expressed earlier, but every year we are adding something in the this technology to access the services in the different milestones. We are an ISO certified hospital. We are ready for Joint Commission accreditation, but nobody wants to come to Afghanistan to do the assessment. Hopefully, with the technology, they will come. So we developed the process for delivering a service. This is an appointment system. If somebody has to have a direct consultation from a hospital to the hospital, so this is the process. And then we have a store and forward system where we can do all kind of telepathology, teleradiology, and so on. So this is a different program. And then the impact is very, very important. We provide the remote support to the medical institution throughout the region, which is very important. And then, if you can see, we have provided around 41,000 consultation, and roughly, these are from the far-flung areas of the provincial hospitals. If you just consider $200 per person, it is almost around $1 million. Around $1 million saving. And then we hope that, and then we are using it for e-learning, which is very important for us. Conferences. Despite the fall of Kabul on 15th of August, our ISO audit was 28th of August. We said, we will not say no, let's do it. Everybody said, what are you doing? Everything is going here and there, and you are talking about quality and blah, blah. I said, no, let's work with the new normal. And we went through, mashallah. Now, we have quite a good, we are being recognized by Ministry of Public Health, the International Development Research of Canada, again, CIDA, the Canadian agency, Global Affairs of Canada. Ministry of Public Health tried to replicate the program in other areas. They linked 1 or 2 hospitals, but then they are stuck. So we were asked to, you hold on, we will extend and then you will be linked, but unfortunately that is there. The Afghan Health Services has replicated this in East Africa and in Pakistan. It's a huge program. And then we have, if you can see this lady, she went through multiple doctors, and then she went to the regional hospital in Kabul and spent a lot of money and time. She was hopeless. She returned back to Bamiyan province. She was belongs to that. But then somebody told her, why you don't go to the Bamiyan hospital? They have some kind of a technology in her own. They told her that through TV they are treating. So she came to Bamiyan hospital, and from there we simply, our doctors diagnose, and then now, alhamdulillah, she is perfectly okay. There are many, many stories like this we have. Every day in and out. We do the cardiac surgery for peds, and then the follow-up we are doing in, through telemedicine. So I would say, this is the only hope, not only for Afghanistan, but a lot of the countries. And what the COVID had taught every one of us in the developing world or developed world, that we have to use technology for things wherever it is possible. Robotics, we were talking about a lot, DVNGs and this and that. But I think for the primary healthcare service can be accessible through the technology. Thank you very much.
Thank you very much. It is amazing to learn how communication technologies can help to make change. So, and the next winner is Saudi German Hospital. Their presentation, Egyptian National Accreditation Model and Reference, won the Grand Prix. It's a Grand Prix named by Dr. Kwan Tae Kim Grand Overs Hospital Awards. So, may I call Dr. Mohamed Ablas, the Regional Director of Egypt and North Africa.
Good morning. My name is Mohammed Hablas, the Regional Director of Saudi German Hospital in Egypt and North Africa. Today I'll talk with you about the gold winner, the Grand Awards, about our project in the Egyptian National Accreditation Modeling Reference. But first of all, let me introduce the hospital. Our hospital started in March 2016, and we are one of a big group from 11 hospitals in the Middle East. The hospital already achieved the Joint Commission International Accreditation, the Canadian Accreditation Diamond Level, and the Gahar Accreditation. Also, we are the only hospital in Africa that member of Mayo Clinic Care Network. The hospital scope service 32 specialty and more than 72 subspecialty. We are serving every year 300,000 patients. Let us start an introduction about our project. I'll just discuss our, say some informations about the healthcare system in Egypt. There is a vision for Egypt for 2030, and part of this vision, which is related to the healthcare, stated that all Egyptians should enjoy a healthy, safe, and secure life through an integrated, accessible, high quality, and universal healthcare system. So there is a reform is going on right now in the healthcare system in Egypt in order to achieve the vision of 2030. But in order to achieve such achievement, there are many challenges. The most important challenges in healthcare that there was lack of an independent body for accreditation and regulation and control of health services. Also, the absence of reference model for healthcare standards implementation, and lack of sharing knowledge culture between different healthcare facilities. But they bought a plan to start the General Authority of Healthcare Accreditation and Regulation in the country, which we are saying it Gahar organization. This organization is responsible for issuing the healthcare standards and also ensuring healthcare facilities in Egypt to provide their services according to the highest quality and safety standards. This organization started to be established, and since this establishment, we started the journey of the project that we will talk with you about it now. Based on this, we started in Saudi German Hospital in 2019 to put in our strategic plan one of strategic goals to support the community and to support the country in the healthcare reform, and in order to achieve the vision of the whole country. And we started to communicate with the Gahar organization in order to work with them hand in hand to start the first step of this big initiative that will make big difference in the country. The goals of us to cooperate with Gahar is to participate with Gahar to evaluate the standards, which is a new standards for the first time to be applied in the country, and to become the first reference model for other hospitals and to be model for them, and to cooperate in the training of surveyors and other healthcare providers. So our institute and our hospital work as a training center for the surveyors. And to promote healthcare accreditation and providing high quality healthcare service, which is a little bit need to be promoted as a culture also for the other healthcare organizations. And to empower the culture of continuous improvement inside Saudi German Hospital Cairo itself. And also to promote the sharing experience and knowledge with other healthcare facilities. Based on this, we started to form our multidisciplinary team in the hospital, led by the leaders, to start this such kind of project and cooperation with Gahar. The stages started by I think maybe the battery. Okay. Okay. In October 2018, as I told you, that Gahar was established as an independent body for accreditation and regulations in Egypt. In April 2019, Saudi German Hospital Cairo started the process of implementing the registration steps, which is a step before getting the accreditation. And in May 2019, Saudi German Hospital Cairo, the first hospital in Egypt to be registered with Gahar as the first hospital. In December 2019, we started our activity to all the community and all healthcare providers, public and private in the country, to promote this step and also in order to share our experience, good experience from being registered and going for accreditation with Gahar organization. And in January 2020, we achieved the first Gahar accreditation in Egypt as a first hospital, even in public and private. Let me share with you just about 2 minutes video about the announcement of getting the first accreditation in Egypt.
Big congratulations كأول مستشفى في جمهورية مصر العربية تحصل على اعتماد الهيئة العامة للاعتماد والرقابة الصحية. ألف مبروك. استطاعت المستشفى السعودي الألماني أن تجتاز كل هذه المعايير بامتياز كامل وتفوق كامل. وهنا يجب أن أقف احتراما لهذا الصرح الذي تم تشييده وبناؤه على أحدث نظم البناء الصحي. في هذا المبنى كان من الصعب أن نجد خطأ.
بشكر الهيئة وبشكر جميع الحضور اللي بنفخر دائما وابدا بان احنا نلتقي مع بعض في كل نجاح يحقق في مسيرة الصحة، سواء كان في مصر او سواء على مستوى المستشفيات في مصر ومستشفيات السعودية الألمانية.
In June 2020, Saudi German Hospital Cairo started to be also a hub for getting the ESQA accreditation for the Gahar standard. So the Gahar standard is a local standard related to Egypt only and started to get accreditation, the standards itself, from the ESCWA. And in order to do this, they used also our hospital to work to evaluate the standards inside the hospital, and they succeeded to get the ESCWA accreditation in our hospital. In March 2021, we worked again in order to update our implementation of the new standards according to the ESCWA in the hospital. And in June 2021, Saudi German Hospital Cairo became verified for Gahar accreditation standards after being accredited by ESCWA again. The results of this project, 3 important results. Number 1, promoting the Egyptian national healthcare accreditation today for more than 141 healthcare organizations in Egypt, and we are working to make it as a system for all healthcare facilities in Egypt in stages for the coming few years. Number 2, Gahar accreditation standards now are accredited from the ESCWA. Number 3, Saudi German Hospital Cairo become the Egyptian National Accreditation Modeling Reference, which is the project of today. So, lastly, I'd like to say that to move forward, one must take the first step. And based on this, Saudi German Hospital Cairo had the honor as the first hospital in Egypt to take the first experience of Gahar registration and accreditation, and this will help in the achievement of Egypt Vision 2030 in healthcare. Thank you very much.
Thank you, Dr. Mohamed Hablas. Thank you all presenters, and please join us at closing plenary session.